My name is George Smith, and I'm an intern at the UT Health Medical Research Center, and I'm going to be going over the treatment of rotator cuff tears. The rotator cuff is a group of muscles and tendons that keep the head of the humerus in a shoulder socket. Each muscle plays an important part in the movement of the shoulder and is essential to maintain day-to-day activities. These muscles are known as the supraspinatus, infraspinatus, teres minor, and subscapularis. The supraspinatus is a small muscle on the upper back that is connected from the supraspinatus fossa of the scapula, also known as the shoulder blade, to the greater tubercle of the humerus. Its function is stabilization of the humerus and abduction of the arm. The infraspinatus is a muscle on the upper back that connected from the infraspinatus fossa of the scapula to the middle facet of the greater tubercle of the humerus. Its function is external rotation of the arm as well as stabilization of the shoulder joint. The teres minor is a muscle on the upper back that connected from the lateral border of the scapula to the greater tubercle of the humerus. Its function is stabilization of the humerus and assisting with external rotation and adduction of the humerus. Lastly, the subscapularis is a muscle on the upper back that is connected from the subscapular fossa to the lesser tubercle of the humerus. Its function is stabilization of the humerus and assisting with internal rotation and adduction of the humerus. A rotator cuff tear. A rotator cuff tear is a complete or partial tear of the tendons around the shoulder joint. It can be caused, for types, it can be divided into two types, such as known as the acute tear and degenerative tear. For an acute tear, a substantial injury to the shoulder, such as a fall or lifting heavy weight, and a jerking motion can cause it. For a degenerative tear, they are more common and are due to wearing and tearing over a long period of time, complemented with age, and such as repetitive overhead motion, stress on the shoulder. Symptoms can include dull aching pain deep in the shoulder, pain at rest or such as lying on the affected arm at night, or weakness when lifting the arm. For treatment, non-surgical treatment, which may include rest, activity modifications such as avoiding any activities that require the use of the shoulder, non-steroidal anti-inflammatory medications such as ibuprofen and naproxen to reduce the pain and swelling, and in rare cases, steroid injections. If the severity of the tear is large or high, or you're experiencing recurring tears, then surgery may be required. In an article titled Treatment of Non-Traumatic Rotator Cuff Tears, with the objective to evaluate the effectiveness of tendon repair in reducing pain and improving function of the shoulder when compared with conservative treatment of symptomatic rotator cuff tear. The study had 172 patients, each over the age of 55, and each patient were individually assigned to a group with either physical therapy or surgery and physical therapy. All patients were to have undergone the same exercise rehabilitation program. In improving scapular stability, proper neuromuscular control of the shoulder girdle, and thoracic composure, exercises were concluded to identify muscles which appear to be tight and restore flexibility. Exercises that stretch the posterior cuff, such as a cross body stretch, and pectoralis minor, such as a pec stretch, were implemented due to relation to abnormal scapular position and helped to improve soft tissue tightness and allow for optimal scapular motion. In the early stages of rehabilitation, neuromuscular control was necessary to improve proprioception, and exercises specific for scapular control were implemented, such as the low row. It was also suggested that exercises that promoted high, middle, and lower trapezius activation with the minimal upper trapezius activation were used in the program, and included exercises such as the side-lying forward flexion, prone horizontal abduction with external rotation, and prone extension. For the results, it was found that a significant number of people with rotator cuff tears were treated successfully with the conservative measures, but it was also shown that after 12 months after the intervention, there was no difference between the two groups, and it was concluded that a conservative treatment should be considered as a primary method of treatment for this condition. Following on a previous study in an article titled Exercise Rehabilitation in the Non-Operative Management of Rotator Cuff Tears, a review of the literature, results were also shown that exercises, when done in a clinical setting or at a home setting, offered superior outcomes over no treatment or a placebo, and did not differ in the outcomes when compared to surgery or multimodal physiotherapy. This was suggesting that physical therapy is fundamental in the treatment of a rotator cuff tear. When physical therapy was included in part of the recovery program, there were beneficial outcomes in patients with symptomatic full-thickness rotator cuff tears. In conclusion, rotator cuff tears can impact an individual's quality of life and lead to surgical intervention. The role of exercise in treating rotator cuff tears is becoming more increasingly popular as a means of recovery for partial full-thickness rotator cuff tears. Patients with tears should consider taking a non-operative treatment path if possible.